Hello everyone, and God bless you. My name is Dr. Kamran Shaikh, and I'm an ST5, a senior trainee in psychiatry. I've been in the field of psychiatry for the last, let's say, 16, 17 years. I've been doing psychiatry, and I passed my membership in 2015. So one of my real reasons for passing this exam, and one of the factors which really helped me to pass this exam, was this course, the Eastern Psych Course, and their book, the Pass the CASC book, which really helped me. So that's written by Sashni Mudlir, and I strongly recommend that book that you must buy. And they have a website called EasternPsychCourse.com. It's must visit, and I have no doubt to say that Sashni is an excellent teacher. She is an excellent mentor and excellent coach for the CASC, and you need a mentor for the CASC. Well, there are good courses for the CASC, and I'm not at all downing the value of those courses. All I want to say, the course begins at a weekend and it ends when the weekend finishes, and thereafter little support is left. Secondly, you see the sincerity of the course organizers. They are very sincere, but you see the sincerity during that weekend, and that's it. But if you want to see the core sincerity and the sincere efforts, and a person who really, really wants you to pass the CASC, you should get the Eastern Psych Course, which is organized by Dr. Sashni Mudlir, who's a very, very hard-working lady, and after her I know how she gets the time, but she is a brilliant lady and organizes her time for her husband and children, and then to the course, and then to they have a WhatsApp. She provides coaching through the online videos, and she will give you feedback. What are you, where are you struggling in terms of CASC, and what is the weakness? Now, when I passed CASC, it was multiple attempts, and my main weakness was the lack of confidence, and that's why I was struggling in the CASC. And after the lack of confidence, it was the lack of knowledge. That was the underlying thing, the underlying factor, which was lack of, that was leading to the lack of confidence, and then the lack of confidence was shattering the performance. So as soon as I realized that I don't need only practice, like I had loads of practice, and there is no substitute to practice, and my practice continued till, but then after having that much practice, the confidence wasn't building up, and I found that there was something else, and that was knowledge was lacking. And so I studied this book, Pass the CASC, and that book gives you, for example, if we just focus one page of child and adolescent psychiatry, so it will give you the scenario, and then it will give you the sentence. It will give you the whole checklist. Now the checklist may not be here, but checklist will be described in the core. So you have to read the whole scenario and you have to see whatever is and what are the things which are being covered here. And it's a detailed station. So that's how the stations are devised in this book. And if you can contact the author direct, look at the benefit, that how much benefit it will cost, it will give you, that you're not only getting the book but getting direct one-to-one coaching from the author itself. Now, that was not the only book. Because it was a knowledge-based exam, I had to consult various books. And I would say, whosoever says in any course that their book is enough, no. And Sashni never claims that. And in the past, some courses may have claimed, but nowadays, no course claims that their notes are enough. And no course should claim, because it's a knowledge-based exam. So what I would advise is that read the sentences from Sashni's book, get the checklist, get the communication and how to say the sentences, and practice it with one-to-one with Sashni, and get a feedback that what communication points you lack. But for the knowledge, I would recommend Andrew Sim's Psychopathology book. Symptoms in Mind, that's a must-read book. And let me see if it is in my library, if I can see it here. I can see some other good books. And Symptoms in Mind, CASC in Psychiatry. So I will tell you that what good books I studied for the CASC. Now another excellent book is by CASC in Psychiatry by Albert Michael. But the difference between this book and Sashni's book is Sashni's book covers more than 90% of CASC stations, although you need to consult the other books as well. But this CASC in Psychiatry, you can see the thickness. This will cover some stations, but it is worth. And I would recommend the medical students, to all medical students, to go through this CASC in Psychiatry. Okay, this next one will be Symptoms in Mind. That is a masterpiece of psychopathology. And then for diagnosis and differential diagnosis, ICD-10. Okay, and this was the version I read, because it gives you bullet points, and that was easy to rote learn. And I have no shame in saying that rote learning is one of the components. As long as you grasp the concept, then you rote learn it, but not without grasping the concept. The concept. So you have to grasp the concept, and then you can rote learn anything. The other things for psychopathology, and psychopathology we have discussed, there's Symptoms in Mind and ICD-10 and differential diagnosis. And after that, the prescribing guidelines in psychiatry, the Maudsley. You can't believe how many stations come from this book only. Many stations come. Nearly all the psychopharmacology stations come from this book. So I would say that read it. I give an example that T-wave inversion and QTC interval prolongation, both can be caused by antipsychotics, and sometimes they put in the exams that both findings are there. Now you have to make a differential diagnosis at that point. It could be an MI, silent MI, myocardial infarction, or it could be drug induced. So you have to know those things, and these are there in mostly prescribing guidelines. And similarly, BNF. For example, somebody asked in my exam when I cleared that mirtazapine, does mirtazapine cause mirtazapine causing, for example, arthralgia or joint pain? Does it cause? Yes, it can. But these like kind of rare side effects or uncommon side effects, they are mentioned in the BNF. So especially if any stations has come, or for the most commonly prescribed medications, you need to know the prescribing information and the all side effects from the BNF itself. For example, clozapine, whether it's safe in pregnancy or not. Similarly, olanzapine, mirtazapine, SSRIs, first generation antipsychotics. So at least read the BNF for, at least for antipsychotics, and some mood stabilizers, mainly lithium and valproate. If you read lamotrigine and valproate interaction, all these things are given in BNF. So read the psychiatry thing from the BNF itself, and then I would say the main bulk I read was here. This was this 2-volume book, and that covered most of the things. So that's New Oxford Textbook of Psychiatry, and you can see the proof of me reading this duct tape because of the reading. Like the book got worn off. Okay, and then this New Oxford Textbook Psychiatry, 2nd volume. Now you can see in my bookshelf the Kaplan and Sadek as well, if you see. But that is also an excellent book, but I won't recommend that for the British exams. For British exams, I would recommend that you go through the this Oxford textbook, because that will tell you how the British system works, what is the role of a care coordinator, what is the Mental Capacity Act, and how does the Mental Health Act works, and what's the multidisciplinary team. So I know Dr. Sashni Murli has written an excellent book, but details of everything cannot be combined in one book. So for the details, and you in the CASC, you need the core knowledge. You need a detailed knowledge. I would say that go through these books, and especially this should be your textbook past the CASC, and all other books will be the books of reference, and cover as many hypothetical stations as you can. For example, let's say schizoaffective disorder maybe never came, but you have to know how to diagnose it. Or let's say dissociative blindness, for example, it came, but other forms of dissociative didn't come. Let's say dissociative mutism didn't come, or mute mental state. Let's say that there is an actor, a role player in the CASC, and they're sitting and they're mute, and they may ask you, the college may ask you to conduct a mental state in writing and nodding, and the patient may be able to write. So they can create for such scenarios. Okay, for example, gamma hydroxybutyrate, they gave this scenario. once, and it came, and transsexualism came, gender identity disorder, and so anything can come in the CASC. I would say panic disorder can come, agoraphobia can come, social phobia can come. So all the diagnostic entities, organic hallucinosis, well, it can come. For example, post-head injury, a person is having hallucinations. Alcoholic hallucinosis has come. So think of all the diagnostic categories in ICD-10 and go through. And having the latest edition of this book and one-to-one coaching from Dr. Moodley, that will be get any teacher. I mean, you can hardly get any teacher better than Dr. Moodley. So I would say that avail that resource and that opportunity, because Dr. Moodley, I mean, of course, there are some things, videos are there in Eastern Psych Course, and they are very beneficial, video lectures. Listen to those. Similarly, there's an Australian website as well. You can go to their videos as well. But the real thing is that ongoing support nobody would provide you, and there is an availability of online support via Dr. Moodlier. She's always available to you till on the WhatsApp and on and over the website and over the phone. So, and that's all, these extra supports, they're all free of charge. And you see the sincerity and the enthusiasm that she wants you to pass. And I can tell you that the morning, like the 2 mornings before my exam, Dr. Moodlier, she taught me, and she went through all these stations with me, and it was so helpful to get her support and help from that. And I can't forget her help and support in my passing. So that's what and that's all I wanted to say to you, that basically that's how to prepare for your CASC. And the same rule applies for all clinical exams, on all main short case based clinical exams. For example, in Pakistan, they have TOEFs, task-oriented assessment of clinical skills. So, and similarly in France, CP, in Australian exam, there are OSCEs. So this book would be helpful to you in those exams as well. So stay tuned and never ever lose hope. Even if you fail, study, 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 and perseverance is the key to success. So keep persevering, and if you believe in God, keep praying and keep your hard work to the best, to its best. That's what I wanted to say. Thank you very much. All the best for your exams.